Infertility and narrow fallopian tubes. Many patients come to us with contrast imaging films from other hospitals saying, "I cannot conceive due to narrow fallopian tubes." Other doctors have told me that I can only undergo IVF treatment. Doctor, do I still have a chance of natural conception? My financial situation and time constraints do not allow me to pursue IVF. Here, let's provide some general knowledge. The thickness of fallopian tubes cannot be directly measured with calipers, it can only be determined by whether they are open or blocked. Narrow fallopian tubes do not necessarily mean a small diameter because we cannot go inside and see. Instead of using a falloposcope, we use contrast agents for imaging. If the fallopian tubes are highly permeable and iodine passes through rapidly, they may appear narrow in the imaging. This indicates good functional morphology of the fallopian tubes and is not the cause of infertility. Infertility with such a condition has other underlying causes, it is not caused by narrow fallopian tubes. The notion of narrow fallopian tubes is often a misconception or misrepresentation. However, we cannot rule out the possibility that some hospitals and doctors may induce patients to undergo IVF by claiming this. If you find that the contrast imaging of your fallopian tubes appears narrower than others, you should be pleased because it increases the likelihood of natural conception. Do not rush into IVF, comprehensive examinations are necessary. These examinations should include evaluations of endocrine function, ovulation, uterine lining, male factors, and screening for chromosomal abnormalities. We need to conduct comprehensive examinations and analysis to identify the true cause of infertility. In our clinical experience, we have encountered many patients in similar situations. Some individuals have male factor infertility, such as low sperm count or azoospermia. In such cases, it would be unethical to perform IVF just because the fallopian tubes appear narrow. That is why Beijing Antai Hospital implements contractual treatment for infertility. If the desired outcome is not achieved, a full refund is provided. This approach aims to prevent doctors or hospitals from exploiting information asymmetry and differences in knowledge structure, leading patients to spend more money on the wrong path.